Well, Dr. Antonucci, let's talk about like some equipment. There's an equipment out there since a few years. Few people know about it. It's called a cone beam imaging system. What is it? Is it like an X-ray machine which does wonders, or what advantage does it have to the patient?
Basically, it's a CAT scan made for a dental office, and what it allows me to do is to see something in 3 dimensions instead of 2. When you look at something in a regular X-ray, all of the information is piled on top of itself, and you really don't have the depth of field. You can't see behind, in front, side, top. You can't distinguish. It doesn't mean that regular X-rays are bad, but what a cone beam imaging does is it allows us, when we need to see depth. We can see height, we can see width. And that's so important, for example, when we're doing implants, because we need to know where the nerve is, or where the sinus is, or how thick the bone is. A regular X-ray doesn't show me thickness, but a cone beam image allows me to see that. So we've invested in cone beam technology, where we can take within 30 seconds time, less than 30 seconds, we have an image on a screen where I can actually see the jaw as it exists in a virtual way on the computer. I could see it as if in a 1-to-1 ratio as it exists in the patient's mouth, and go ahead and from there plan implants and plan a case. So it's allowing me to do a better diagnosis, a diagnosis that really can't be done without it. And it's become basically in implant dentistry the standard of care. What we found along the way was that, with oral surgery, when looking at third molar extractions, if I don't know where a nerve is sitting in relation to a tooth, I'm at a big disadvantage. So the third dimension, being able to see depth there, is priceless. So we use it all the time when we're looking at difficult extractions in areas where there's anatomy that gets in the way that may fool us otherwise. In orthodontics, when we send a case to an orthodontist, I prefer that an orthodontist would use a three-dimensional imaging as a part of their diagnosis, because they're better able to understand and treat the patient. In endodontics, with root canal treatment, we're better able to understand where an infection comes from when we see the third dimension. So we don't use it all the time, but it is when it's there, when it's used, it's necessary to be used, and the information that we get from it, we can't get in any other means.
Well, that makes lots of sense. Obviously, three-dimensional, from a mechanical machinery engineering viewpoint, which I understand well, since that's what I have a long time ago been trained on. If you can see what's behind it, like you say in a root canal, sometimes there are several roots in a tooth. People sometimes don't realize that there's 2, 3, 4, whatever, and one lays after the other one, and three-dimensionally, you will probably see that in the first place, and then for all purpose have to be less looking, searching, less surprises, and that just must mean less chair time for the patient, less chances of hitting a nerve which shouldn't be hit, and all that type of stuff. Am I right there?
Well, there's a higher degree of safety. There's a much better diagnosis. You're really going into, as a doctor, I'm going into the treatment with a full idea of what I'm doing. I'm not going in any way blind. I know exactly what's up. And that's the biggest benefit. Does it save time? Yes, it saves time in terms of work, but the biggest benefit is the fact that I get an accurate, complete, comprehensive diagnosis. And without that, we're learning as we go. And I don't think any patients want the doctor to be in practice as practicing on them and learning as they go. The right way to practice, it's called dental practice, but the right way to practice dentistry and medicine and anything else is to have a full understanding and knowledge of what you're doing before you do it, not while you're doing it, and learning as you go. And cone beam imaging, the third dimension, allows us to do that.
So you said you're not always doing that. You're doing that like, you place an implant, you do certain procedures, when you think you need that that three-dimension impact. So basically, a person still needs to be biting on his bite wings and choking on them while doing them, or are you having other technology there as well?
Well, yes, we use the reason that we don't use cone beam imaging or three-dimensional imaging all the time is because there's a higher cost for it. So when there's no need, there's no need to charge a patient. No need for the result. You don't use the technology. There's also a cost in terms of radiation because it is more radiation that's used, and so you only use it when you need it. It's necessary when you're doing implants. That's the bottom line.
Okay.
It just has to be done. It doesn't diagnose decay well, so I wouldn't use it to diagnose decay. A simple digital periapical or bite wing X-ray does that job at a very minimal dose of radiation to the patient and gives us all the information that we need. So you use the tool or the piece of technology that accomplishes the job in the least expensive way in terms of cost and the least expensive way in terms of radiation load and with the biggest benefit. That's really the guidelines that we go by.
Thanks a lot for informing us about the cone beam imaging machine. Thanks a lot, Doctor.